Hello and welcome to the Safe Passage for Children of Minnesota, a training session for volunteers for the 2013 state legislative session in Minnesota. First of all, what is Safe Passage for Children of Minnesota? For those of you who are new, we are a citizens group and we advocate for systemic improvements to the state's child welfare system. So we are an advocacy group and not a direct service group. And child welfare refers to child protection and foster care programs and related services. So these are the core public services that have been in existence in the United States for over 100 years, and they are about protecting children from child abuse and neglect. The mission of Safe Passage is to redesign the Minnesota child welfare system so children are safe and reach their full potential. Clearly embedded in that mission is a concern that children are no longer as safe as they should be, and because of trauma and stress and because we do not reach them and their families with services on a timely basis, they are inhibited from reaching what their potential is as children and as adults and citizens. So how we work is that Safe Passage trains volunteers to advocate with their elected officials, both at the state and county level, for systemic improvements, and we use publicly available data to do that. And we have found that volunteers are effective because they almost always can get appointments with their legislators, and they often have more credibility than paid lobbyists because they're there strictly because of their concern about children. We are, just to frame this up in terms of Safe Passage, we are a unique model of citizen engagement. The cost, because we are so volunteer-driven, is about 20% or less of traditional think tank advocacy models. We are nonpartisan, we're non-ideological. Our volunteers come from across the political spectrum as well as people who are not politically involved. We are sustainable. Most reform efforts in states that are focused on child welfare have been driven by either a few legislators who cared about the issue or by a dynamic state leader who is the commissioner or director of the state child welfare programs. And often when those leaders move on, the reform efforts flag and often eventually kind of lose ground over where they were before. So because volunteers, even if individual volunteers may leave, new volunteers come along, and therefore the volunteer base is renewable, and the effort can be sustained even if key leaders in the state or county move on. And we're unique because we very few issues are about things that do not benefit the individual themselves or their family or children. So this is an issue that benefits the community overall, and not just the individual or the children. Not that there's anything wrong with that, but there is a space for issues that are community-wide that this fills. Accomplishments is basically, we typically have had a group of about 80 very passionate volunteers who have lobbied successfully, for example, for the 2012 study of child protection by the state legislative auditor, and I'll talk more about that in a minute. And we are currently doing a groundbreaking study of child protection court cases, known as CHIPS cases, or Child in Need of Protection and Services. And that is going to be a study that's unique because it's operational in nature. It will show how the system works and what happens to kids in the system, whereas most studies are more individual about the impact of specific programs or treatment on children. Just a bit about why child welfare. Of all the areas that we could focus on in advocacy, why not juvenile justice, children's mental health, or why not provide direct service like tutoring services or and even a number of things we could do? Well, basically, it's a systems change model, which is why we don't do direct service. It's a valuable thing to do, obviously, but this is an area that we're doing, which we think contributes. Metrics or numbers or performance measures are more standardized and accessible in child welfare than in related fields, such as mental health or juvenile justice. And that's because it's been more or less set up the same way across the country. There's one common computer system that is used. people in states and counties across the country gather the same data in the same way. There's a need for a lot of improvement, but there's a base of common measurements and tracking information that does not exist as cleanly in mental health or juvenile justice areas. So that's one important reason. Another is the belief that outcomes run in herds. This is the concept promoted by Mark Friedman, and you can look at some of his accountability and responsibility work on the web. And the idea is that in a community-type program like this that affects broad areas, that by getting outcomes to improve in one program, it brings other programs along as well. So we have found, for example, from looking at data in Hennepin County, that over 50% of child welfare families are in at least 2 other systems, including mental health, juvenile justice, also adult corrections, adult mental health, and so forth. So if we are able to reach out to families and provide them some meaningful practical help, things start improving for the families and the children, those outcome measures will start to improve in these other programs as well. So just a quick background for those of you who are not as familiar, haven't been in the system for a while, a review for those of you who have, on Minnesota's organizational structure and programs. First, Minnesota is one of 11 states that is supervised by the state, but locally administered. And here in Minnesota, it's run by local agencies representing 84 counties and 2 tribes. The 84 counties are fewer than the 87 actual counties in the state, because several counties have merged their child welfare programs. And the role of the State Department of Human Services, or DHS, is to provide guidelines and technical support. Our funding structure is that counties pay for most services. There's 20 or 30% that comes from the federal government, 11% or so from the state, and everything else comes from the county tax base. So we are the second lowest in state funding for child welfare nationally at 11%. And the state has cut its contributions repeatedly. This slide actually needs to be updated because Safe Passage did some research for the legislature and found that the total amount that was funded by the state in 2002 was about $90 million. And so the cuts have been down to about $20 to $30 million in cuts. And it's been difficult to estimate that because the money has been moved around into different block grants and has also been used for other programs. But that's our best analysis so far. But it's been substantial, and it's been enough to keep us near the bottom of states' contributions to the program. So just basic program facts from state and federal reports. Counties and tribes get approximately 56,000 calls, reports in common language annually alleging child maltreatment. They come from the general public and from mandated reporters, about 30% from family, friends, neighbors, or the general public, and the other 70% from mandated reporters such as school teachers, school social workers, physicians, and people that in those types of jobs. Of these 56,000, we screen in about 17,800 for assessment in a typical year, and 70% of those are screened in are diverted to a voluntary program known as Family Assessment, or FA, which was implemented starting around 2001. So only about a third or so of the cases that get called in are screened in for an assessment, and only about 30% of those go into the traditional court process. The other 70% go into the family assessment. Some basic program facts. Out-of-home care. In 2011, 11,368 children spent time in out-of-home care, mostly foster care, 34% lower than 2002. And the general feeling across the country, this is a national trend, is there are fewer and fewer kids in out-of-home care, and that's a good thing. But there's actually not much research to show how children are doing. And there's a lot of anecdotal information to suggest that children are being sent back home into situations where not much has been done to actually help the family do better with the children, and so they're continuing to be abused. So the ones that did go into out-of-home care, 2/3 of them were returned home. What we know about child maltreatment in Minnesota. The Department of Human Services doesn't report the total number of calls. They technically think of these or refer to these as referrals. That's all the reports that come in from whatever source. And only the ones that are screened in appear in DHS documents, and they are called reports. It's very confusing nomenclature. And Safe Passage, one of the things we've accomplished is that we found the data that showed that there are actually 56,000 of these referrals or reports in ordinary English in federal reports, and then we made that information public. So people became aware that there's almost 3 times as many actual reports as what it appeared from the state's annual report to the legislature. What do we know about maltreatment? We screen in 32% of referrals of reports. I'm going to start using that term. And the average for states is 61%. So it raises the question of whether we are that much better at the screening process, or are a lot more children in Minnesota being left in whatever situations they're in without any protection. And there's limited data that suggests that some children are being referred or called in or reported 15, 20, 25 times. But again, there's not consistent data on this across the state. And we'll talk more about that as we go. We issue maltreatment findings for 18% of those screened in referrals compared to 24% nationally. So this is another data point that suggests that we are underserving children who are at risk and who are being abused or neglected. And half of those that are actually, screened in, and where there's a finding of maltreatment and not offered services, and there's no data on who actually does receive services or whether they are effective. So it's kind of an area where we really don't know enough about what happens to children once they are reported into the system. And what we know about family assessment is that counties don't keep consistent data on it. There was research by a group in Hennepin County known as the Children's Review Panel that showed that once the 70% or so were diverted from the traditional court process into family assessment, 75% of those were not even offered services, and 17% in total actually received services, and again, few evaluations to see if they were effective. And statewide data is limited. That's part of our mission, is to make it less limited, but it suggests very similar results. And out-of-home care, drop in the number of children in foster care is a national trend, driven in part by a philosophy that children are almost always better off with their birth families. There's some truth to that, but I think you have to look at it case by case and evaluate whether children really are doing better, and also, of course, by cost consideration. So it is widely perceived as a positive development, but there's very little data on how children are doing with this trend of forcing as many children as possible back home rather than providing foster care. So that gets to our legislative goals for 2013 to 2017. Very broadly over this time span, we want to help establish data integrity for screening reports of alleged maltreatment and for this voluntary child protection program of family assessment. Secondly, we want to start measuring the progress of every child using validated screening and assessment tools, and we'll talk more about what that means in a minute. And then implement evidence-based interventions. So we will go into that as we go here. But here first is kind of a visual frame or a visual picture of what our strategy is over this period of 2013 to 2017. The color coding is that the green represents efforts to get reliable data, to get better data, so that we know what we're dealing with. The blue is the operational end of that, where we actually are not only getting improved data, but start using it to see what's going on with children. And then the yellow that kind of transitions into red is to start improving performance and outcomes, and then having a process in the red for ongoing continuous quality improvement. So just starting with 2013 with the top line on the left there, improved maltreatment reporting, the Office of the Legislative Auditor recommendations. We're going to talk about that in more detail. But this is simply efforts to get higher quality data and more consistent data about what's happening with children around the state. Then halfway through 2013, after the session, we hope that we can engage the Department of Human Services and the counties and other stakeholders planning child screenings and assessments so that we can begin to get a baseline on children when they hit the system or when they come back into the system. And then in 2014, continuing down lower with the green, we want to start doing the same thing for family assessment data, and we want to start analyzing evidence-based interventions to see what kinds of programs and services are working elsewhere and are supported by data and research so that we can start implementing things that are the most likely to be useful. Then as you go across, if you look at the top line, in 2013, improved maltreatment reporting, and in 2014, we want to really start getting reliable data on maltreatment, and then in 2015 and beyond, children will get the services that they should if they're being maltreated. And then the second line down there, which starts with planned child screenings and assessments. In 2013, we hope to start implementing those in 2014, and then we will start to get better data out of that. And then finally, we'll move to improved child outcomes from there. And the family assessment and evidence-based interventions, the bottom two, follow a similar path of figuring out what to do about the data, then getting improved data and starting to manage with it, and then finally getting improved child outcomes. So that's a visual picture which, may be helpful in terms of getting an idea of the overall arc of this legislative strategy. So starting with 2013, we want to enact the legislative auditor recommendations, which we will explain in more detail. Restore some of the budget cuts over the past number of years, particularly 2012. Request Department of Human Services to start investigating screening and assessment tools and involve stakeholders in that process, and then maybe some additional possibilities that we could pursue this year. But the Minnesota State Legislative session is like a bus that makes a lot of twists and turns and things you have never seen, so we have to be flexible and ready to update our talking points and follow the legislation and do what we need to do to get the most we can out of this session. So let's talk about the first piece, the legislative auditor report. In 2012, the legislative auditor did a report on child protection screening practices statewide. This idea was initiated by Safe Passage for Children, and the process is that every legislator can propose areas for study, and we got some champions to introduce this, and then our volunteers followed up with legislators and encouraged them to vote for it. So out of 63 topics proposed, this one that we proposed came out number 3 overall. And the legislative auditor is important because they're very highly regarded. They work for the legislature rather than the administration and are sort of like a local, a state-level version of the Congressional Budget Office. They try to call it as they see it and are considered to be objective. And so the report carries some weight. So when the report came out in March of 2012, findings included that maltreatment standards vary widely across the state. The counties keep unreliable data on referrals or reports of child abuse and neglect, and the role of the Department of Human Services is weak. So let's talk first about the first item, screening variations. They found, for example, that screen-in rates when people report child abuse range from 0 to 89%. So they don't screen in any or they screen almost everything. And between years in individual counties, they vary widely sometimes as well. Then the standards for what they use, and the reason partly that they screen in such different numbers, are that the standards vary widely between counties. So what is risk of harm and what is actual harm, and when should cases where there's risk of harm be screened in for child protection assessments? And some counties, in essence, if you read the report, say there has to be actual harm before they can screen it in, whereas others will take a high-risk situation and screen it in. The latter is really consistent with state statute and with practices across the country, so only screening in children when there's already been harm is not consistent with good practice. But given the way that the counties, basically the state is set up, where the Department of Human Services only provides guidelines and has very little ability to require counties to work consistently, and take this kind of outlier approach to child protection and, do that as they wish. Another area that the legislative auditor pointed out is a lack of clarity about neglect, which includes medical neglect and emotional neglect, and also food, clothing, shelter. So taking the term necessary food, they pointed out that there was no clear definition of what necessary food is. So one of the methods that the legislative auditor used to try to get at these issues was to take a series of stories, 10 scenarios, that they told workers, and then they asked the workers, would you screen this case in or not? And in the case of necessary food, it ranged from, concerns about children not having enough food in the house and malnutrition, where they would screen it in, to some counties saying, well, unless the child was in the bottom 3%, 3 percentile in terms of physical growth and development, they wouldn't screen it in for a look. Well, this is clearly a situation where if a child has been deprived of food long enough that they have stopped their development and are in the bottom 3%, that's too late, and that's too weak of a standard to be using. But again, without a clear definition statewide of what counts as abuse and neglect, this is the kind of variation you get. And they similarly disagreed in how to assess and either screen in or screen out situations where children were exposed to drugs or domestic violence or the presence of a sex offender in the home, or adverse effective impact on mental health of various situations, or educational neglect. Counties were kind of all across a range of responses to those types of issues. So as one example of presence of a sex offender, some counties would not screen in the case if the sex offender had only perpetrated against adults, whereas the practice of others was to consider all sex offenders a reason to take a closer look. Or in terms of adverse impact on mental health, one scenario that the legislative auditor presented was a situation in which a father was brandishing a gun and was threatening and intimidating, and then shot a child's dog in front of the child. This was not screened in by a very significant number of counties. They referred to it as the yuck factor, but not something that was actually physical harm to the child. However, national standards clearly characterize this type of situation as terrorizing, and that it is a form of mental abuse, and that it is a high risk also of physical abuse, and would clearly screen this in nationally in terms of the way other states and the American Humane Association look at this. So it's an example of not being in touch with or accountable to standards that are best practices or even reasonable standards across the country. Data variations. This is kind of one of the results of this. Some counties don't keep enough data to identify patterns of abuse or neglect. And in the legislation, in the statutes that the legislature has used to define this area, they require that cases be screened in for an assessment or a traditional investigation if there is a pattern of abuse or neglect over time. But counties are not required to keep the data necessary to identify this. And some counties use untrained staff to make that initial screening decision. So they haven't been trained in what child protection is, but they're the front door to an agency, and so they decide whether or not to refer it on to the child protection. And then only some counties enter screened out reports into SSIS, which is the Social Service Information System. That's the state system. So it's obviously not possible to identify patterns of abuse or neglect as required by law if those screened out cases are not entered into the system to begin with. Further, the Department of Human Services does not report screened out calls to the legislature. So as we mentioned earlier, for some time, the only reports that would show up in the annual report to the legislature were the ones that were screened in. And it wasn't clear to people that there are 56 or 57,000 reports of child abuse each year, and only 17 or 18,000 of them are are showing up in the state's annual report. And so I'm going to cover the bottom point on the next slide here. So as part of our agenda, we want to first of all clarify key terms that the legislative auditor pointed out, such as risk of harm and neglect, and require counties to keep enough data on prior reports to identify patterns of abuse. However, the way that the Department of Human Services responded to the legislative auditor's finding was to eliminate the requirement at all to keep data on prior reports, which we think is the opposite of what the legislative auditor was getting at with that recommendation. So require counties to enter all referrals, or I'm using that term to mean reports of abuse or neglect into SSIS, and require the Department of Human Services to include, again, referrals or all reports of child abuse, not just the ones that are screened in their annual report to the legislature. And then finally, consistent with the recommendations of the legislative auditor, we are hoping to have legislation that will require the Department of Human Services to issue rules rather than guidelines. Rules defining what cases of child abuse and neglect reports should be screened in for an investigation or an assessment. Right now, the department issues guidelines, which the legislative auditor pointed out are basically amount to advice, and rules would have the effect of law. So the legislation that we hope to propose will require the department to issue their guidance to the counties as a rule rather than just guidelines. So let's talk about what starting to get decent data is going to show. It'll show how many times children are screened out, and since what limited information we have is that sometimes children are screened out many, many times, and we don't know how many times they receive services as opposed to screened out without any. And then how many times they previously referred to family assessment. If 70% of families are now put into the family assessment track and 75% of them don't even get offered services, then it's not very meaningful to screen them in for service in the first place. We would like to see then of those who do get a family assessment and who are offered services, how many actually got them, how many engaged with some agency or with the department to get the county department to get services. Some evaluations of those services, whether they're effective, and we'll get to that in a minute. And then we can tell total length of time children are known to the system. If they're known 5 or 10 years over time and they keep showing up in the system, obviously we're not engaging them effectively. And the number of times children are re-abused after the first time they're known to the counties and courts. And then were referrals made by mandated reporters as they should have been. So more benefits of improved performance. We will see if children are being repeatedly screened out. We'll see if there are persistent failures to engage families in family assessment, and perhaps in some counties it's much better, but we won't know until we get some data, and we'll see how they're doing. Then it becomes possible to compare counties and to see, gee, you know, there are many more kids in County A than B that are being screened out multiple times. What's going on there? You can start asking good questions. And then it's also easier to spot what's working, who's doing a good job and best practices, and to spot trends and be able to respond appropriately. So here's a current example, or a couple of current examples of performance and why this information is important. There was the case of the Howard boy, which was reported widely in the newspapers in November of 2012. 8-year-old adopted boy, was adopted with 2 siblings. He weighed 35 pounds. He was 3 feet 5 inches tall, about half of what he should have been for his age. His bones were sticking out. He was suffering from brain atrophy and a slow heartbeat. And for at least the last year, he had been beaten, regularly locked in a room, forced to sleep in some kind of a plastic bucket. He was hosed down by his siblings twice a week to clean him. He was locked in his room with his parents sleeping outside the room so he wouldn't, quote, steal food, unquote. He was found by the police to be looking for food. They returned him home, apparently. They apparently went to church every Wednesday with all the family. Either this boy didn't show up and somebody might ask a question, or he did show up and they really should have asked some questions. The Howers family are state licensed foster parents, and their license was renewed in March of 2012. And then the judge did remove this particular boy, but returned his two natural siblings and his step-sibling home, despite evidence, at least as reported in the press, that they too were malnourished. Another current example is Shawnee Bradshaw, also November 2012, and these show up, fairly regularly in the paper, as you may know. It was a less than 2-year-old child who was rendered quadriplegic by the mother's boyfriend, and the press talked to people and others in the household. We don't know how many people were there or what they were doing, but said that the child was often beaten and had blood clots in her eyes and could be heard to be crying and screaming. There's another infant that was mentioned in the household. No one knows. We don't know what the status is of that child. So better data would help us to figure out who is accountable. There was a dentist in the Howard boy situation who saw enamel coming off his teeth. As a mandated reporter, he was required to report that. And the question is, did he? Well, we don't know. I mentioned the police picked up the child while searching for food. Did they report that to the county agency? And of course, the DHS license renewal process is supposed to pick up situations of this nature. They're supposed to go out, physically look at the situation. They're supposed to talk to the children separately from the parents and use other techniques to be able to identify problems. And then Shawnee may have been known to authorities because family and friends frequently report situations of this nature. But again, no way to know if or how often this occurred. So, other changes in the legislation that we want to look at in 2012, restore some of the cuts to the block grants that have been funding this in the past. A companion bill is proposed by Senator Jeff Hayden to restore some of the funds. And the block grant that funded this in the past was called CCSA. We won't get into what all that stands for. It's been changed to the Vulnerable Children's and Adults Act, and it's very difficult to know how much money was in these block grants in the past and how much would need to be put back. Other things that we would like to get to if the opportunity arises is, first of all, to require physicians to report prenatal drug abuse. We have been reviewing cases in Hennepin County and have seen a number of situations in which fetal alcohol syndrome could have been avoided had there been intervention earlier. But physicians a couple of years ago in Hennepin County lobbied successfully to be exempt from reporting child abuse in these situations if they were providing prenatal care. And this was over the objection of Ramsey County and others. We would like to raise that issue and reverse it so that doctors are required to report prenatal drug abuse, particularly if it's likely to lead to some sort of, birth defect or developmental delay in children once they're born. And programs such as in Ramsey County have shown that it's possible to do this without breaking the relationship with the mother. Also, we'd like to see reporting of selected information immediately on child deaths and serious injuries. Right now, the state report on child fatalities and near fatalities is supposed to come out annually. The last time that it came out, there was a 5-year gap between that and the previous report. So we would like to get information in terms of whether there were previous reports in these situations and what the county's response was. We'd like to talk about reports on failed adoptions because obviously the Howard situation we mentioned is not unique, and we hear anecdotally reports all the time of failed adoptions, but there's no data on that. And then we'd like to speed up the implementation of mental health screening. Last year, the Children's Defense Fund got a new provision in the law which required counties to do mental health screening on children starting as early as 3 months when there was a substantiated case of child abuse. This was delayed by the department until 2014 based on the fact that it would take them some time to get this data. But Children's Defense Fund found some money for them to do this. And so we would like to move that mental health screening up much earlier so that it starts sometime this year, and also to make it monthly, not annually. The reason for that is the DHS annual report comes out in August or September of the year following the calendar year. So that means 20, 21, 22 months after the data first starts to become available is the first time that the public gets to see it. So we'd like to see this as part of their regular monthly management reports that they post on the web. And then other items for 2013, the legislative order recommendations were to train county staff so that they have consistent screening standards and to train them in what reports they should enter into the computer system, the SSIS system. And then, as we mentioned, to start planning the screening and assessment process in after the legislative session in 2013, so that DHS would work with stakeholders and build on the instruments that are required by the DHS Mental Health Division. I mentioned one doing mental health screening and children as a substantiated case of abuse, but there are others as well in the mental health area. And then to pursue funds for planning the next step in this. So the next steps in 2013 for volunteers will be to follow updates as the bills are introduced, because as the school bus showed, sometimes move quickly and erratically in terms of which committees they go to and whether there were changes introduced by other people and other things of that nature. And once we get a bill into the hopper and we have something to work with, to get to your representatives early, your state senator and your state representative, and possibly to participate in a day on the Hill to just kind of roam the halls and talk to legislators. You can always schedule your own meetings with your representative or senator, but we will help you schedule. And if at all possible, we'll get you a buddy to work with, someone who's done this before, ability to go in a small group so that you and ask if you can to be available to attend hearings on short notice. Not everybody's able to do this, but it really helps to have people show up at a hearing. And then, of course, asking for you to send emails and phone calls as bills move through critical steps through committees and votes. Then to talk about after 2014 and beyond, we talked about improving the reporting for family assessment and getting the legislature to reinvest in child welfare. And third is to require counties to use evidence-based practices and services. So we can start measuring outcomes and not just processes. And at the moment, we're not even measuring processes very well, but we want to get to do that and then get on to measuring outcomes. And then so we can hold counties accountable for actually improving outcomes. So let's talk a little bit more about this bigger picture. Evidence-based practices. We're talking about this in two categories. The third is screening and assessment. And the first is screening and assessment, and then we're going to talk some more about the evidence-based interventions. In terms of both of these, there's new leadership from the Federal Children's Bureau, which is encouraging states to do screening and assessment for every child every time they enter or re-enter the system, and if they're in the system for a while, periodically. Let's say they're in foster care or they're in the court process and they're every 3 months if you're an infant or toddler, and maybe every 6 months if you're an older child. And the recommendation is to track children's progress much more holistically than has been done in the past, particularly in 4 domains or 4 areas of life. First, physical health and development, so that would pick up on something with the Howard case. Cognitive skills, that's important because we know that the impact of trauma on brain development is to limit children's ability to develop cognitive skills. Behavior or interpersonal skills, empathy, ability to deal with stress. Those are things that are also affected by childhood trauma, and you want to measure that and see how children are doing. And then mental health generally, including particularly trauma screening. The idea of tracking children over time in these areas, every time they show up in the system or periodically once they're in, is simple. It's basically to ask whether as a result of children being in the child welfare system, are they doing better or worse. So just as a very simple kind of picture of this, let's just take a look at this. This is a basic height and weight, normal height and weight chart, which shows where children are from birth up to 36 months in terms of their weight or their height. And so what we have here is, let's say the Howard boy, who's 35 pounds and he's 8.5 years old, he would be like down here when he comes in. Let's say that he came in here, and he was a little bit older, obviously, but just to show the concept. And he would be under the 5th percentile. But over a period of time, as he's in the system and he gets food and he gets other forms of care, he should start to move up closer to the norm. And these, the thick line in the center of these is the 50th percentile, so half the children are above or half are below. And the screening and assessment instruments that the federal government is proposing and that we would look at in Minnesota are normed to the population as a whole, whether it's for cognitive development or mental health or physical development. So you can basically see that regardless of where a child starts, whether the system is making them, helping them be better off or worse off over time, and they should move up. They may not move all the way up here or above the 50th percentile, but they should be going in the right direction. So that's essentially what the, what the idea is with this. And so what the federal government has said is that they are going to increasingly tie these, let me see if I can get rid of this thing here. Oh, here it is, normal non-dry. There we go. Funding will be increasingly tied to evidence-based services and measurable outcomes. So in terms of evidence-based research, what we're talking about is services should have robust research-based evidence of results. And the federal government throws out 15 or 20 examples. They're not meant to be exclusive, but to give an idea of what they mean. So there are programs called Parent-Child Interactive Therapy, or Triple P, which is family therapy combined with parenting skills training, or multi-systemic therapy. These are kind of services that kind of fix the damage. And there are other kind of services earlier on in the continuum to prevent damage from occurring or to mitigate it earlier. These are services that have to be implemented kind of with high fidelity to the original model in order to get the results. So you really want to know which programs worked, exactly why they worked, and be able to train people to do it the right way, and then you should start getting better results. Also, to require providers of the more ordinary services to show that they are getting results. So most programs use parenting skills training, chemical dependency treatment, anger management, things of that nature. And in Miami-Dade County, for example, we've talked with them a couple of times, and they use pre- and post-tests to see whether or not, say, if it's parenting skills, that a parent's ability to parent children without using harsh techniques that cause damage, whether it's beating them or forms of mental abuse, to see if their skills have actually improved. And judges are increasingly making their decisions about whether to remove children or whether to reunite the family or whether to keep the case open based on how much progress parents are making in these pre- and post-tests. So now in Minnesota, typically, say for parenting skills training, if a parent goes and attends 6 out of 8 sessions they're supposed to go to, they get their ticket punched and they're reunified with their children. It doesn't necessarily have much to do with whether their parenting skills improved. So this is a much more objective basis for making decisions in court. And further, the county is ending contracts with vendors who aren't able to get consistent improvements in these areas and aren't able to help families get reunited. And they're giving the money to vendors who are doing better at that. So that's another component of getting a results or outcomes-oriented system underway. So the role of volunteers as we go over, as these things happen over time, is to monitor implementation. And that basically means getting counties to do reports and having volunteers, work with us to look at those reports, and then in this case probably follow up as much with their county elected officials as well as their state elected officials. to say, hey, this is going in the right direction, that's great, keep it up. Maybe a little bit more money here or a little bit more money in this other place would be a good idea. Or it is not going in the right direction, we need to step up our efforts. So we talk about, I mentioned the Utah model here. Essentially what they did was to take a lot of basic performance data and get it right down to the worker level where the worker could run their own reports and see how they were doing. So basic performance measures like what percentage of time did I get kids back into court within the required time frames? Or if I had children who were, where the plan was to reunify with the family, how many of them did I have within 50 miles of their homes? If they're in foster care, were they within 50 miles? And that's important because that's sort of the cutoff point in reunification plans for being effective. If kids are too far away, it just doesn't work. Or just very basic social work things such as did you get out and see the child in foster care or see the family that you're working with at least once a month. That's another one of those kind of cutoff points where results go down significantly if you don't get out there more frequently. So they took about 20 of these standard kind of social work practice measures, started tracking them, and they gave workers the ability to see their own information. And within 2 years, on a statewide basis, they went from about 60 or 65% compliance with these practices to 92, 95% across all of their 6 or 7 regions, and they've stayed there since. So just being able to see the data and put it in the hands of the people who are working with it in the hands of the public by itself has a salutary effect. It's the basic concept of what gets measured is what gets done. And people will always try to improve when they can see what they're doing and what numbers they need to reach. So to start to get information on these things, the results of these, as well as the screening and assessment updates and the use of evidence-based services, effectiveness of contractor services, to start to report on all of these things and be transparent about them so we can see if the system is headed in the right direction, and kind of ancillary things that would be possible then to report child progress at every court appearance, and we would want to push for that. And then the Department of Human Services does periodic program audits, so we would want to have, looking at these items be added to those audits. So these are all ways in which we can take this information and actually be able to use it for improved management and to make sure that these things are working. So essentially, that is the that's the training for this upcoming session, and we are going to be keeping you apprised of developments, and we'll put together, once we get the bill in place, we'll put together some talking points and kind of do a refresher, and with you and maybe 1 or 2 other people, make some appointments and go talk to the legislators about the bill. So you have our contact information. Send questions or give a call and let us know what what questions you might have. And we hope to see you at the legislature. And thanks for going through this training. Goodbye.